Hi Jahan.
Hi Kim.
Selamat Hari Raya. Thank you for spending
Thank you.
your first Raya with me. And of
Yeah,
course
no
with all
worries.
the viewer. So selamat
Okay.
Hari Raya to you.
Selamat
And
Hari Raya
I
to
heard
everyone
that you're still
too.
in Singapore. You can't go back, right?
Yes, I'm still here, stuck until year end, I guess, because we're not allowed to leave.
So are you still working during Raya?
Just off for today and tomorrow, and then I'll be working on Tuesday. Tuesday onwards. So
Okay. So
yeah.
maybe you
Okay.
can just introduce yourself. I mean, Jehan had been my friend since long time ago, and also she did fencing as my also not say junior, but we trained together. But in the end, she
Yeah.
moved from Sabah to Singapore to work as a cardio nurse now. So
Yeah.
maybe she just tell you about what she really doing and what's her background. Yeah.
Okay. Okay. Hi guys. My name is Jehan. So as Kim say, I've been working in Singapore for 2 years now at the National University Hospital under the Heart Center in Singapore for 2 years. So my background is I work in the invasive cardiac lab, which or also known as the angiography center. So what we do there is technically coronary angiograms and angioplasty, and implantation of external pacemakers and electrophysiology and radiofrequency ablation. So that's quite a very medical term, but technically we fix people's heart under radiation to look at the heart anatomy and physiology, and any blockages we find, we sort of unblock it by putting in stents or balloonings. Yep.
I heard that currently now they have a newer technology to do stamps, and you don't need to, because a lot of my friends last time and also patient, they did do a heart surgery before, and they said that they show me
Okay.
they have a huge mark on it, but
Mm-hmm,
currently
mm-hmm.
they just do a little. It's not said a huge surgery.
I think it's
Yeah.
called minimally invasive.
Yeah. So is it
Yeah.
the same, or is there any difference, or who can do it? Or yeah.
Okay. I would say technology and innovation wise, how it has improved from many years ago is the imaging technologies we have has helped us significantly to view where the blockages are, what the blockages are, how long they are, so we can gauge like how long the stent should be, where should we balloon it, and we can optimize the stent opening. So that is for lesions or blockages in the arteries that are fixable by angioplasty. So otherwise, in a more complex lesions or blockages, if the lesions, I mean, the more advanced technology now is, it's called minimally invasive, but that's under cardiothoracic. Sorry about that. So that's under cardiothoracic surgery, which is done by cardiothoracic surgeons. So it's called a minimally invasive bypass surgery, where they just fix like one vessel as opposed to like the 3 or 2 other vessels that they need to harvest from other veins as well. So yeah, and otherwise there would be other technologies such as fractional flow reserve, which we actually measure the flows in the vessels when we see if there's a blockage, and we don't instantly stent it, we don't instantly do anything to it, so we sort of like give some medications to induce blood flow to the artery and see if it's significantly reduced, then it is deemed for us to fix. But otherwise, if it's like less than significant value, we won't fix it. So we technically don't stent everyone if they don't need it. Yeah.
Okay. So maybe back to the question. So Actually, how long of a cardiovascular nurse works in a shift? Like, and why do you want to choose? Is there any like, because you are being designated to do as a cardio nurse, or you choose to be a cardio nurse?
I think because before I went to Singapore, I was in our local hospital in KK, which is KPJ Sabah. And during the interview, I sort of told them I worked with one of the renowned cardiovascular doctors. So they sort of like put me in the cardio cluster then. So they choose me. I did not choose them. So,
Okay.
and how long in one shift? I think it depends on what job category do you fall into, whether or not you're the 42 hours or 40 hours shift people, because Singapore, unlike, I don't know how other country works, but we do have different categories for different nurses. So it goes on from 7 to 9 to even 12 hours a day.
That's quite long.
As a nurse. Yeah, I mean, but I think generally not just cardio nurses work that range of hours. Like every nurses does that. Yeah.
Okay. So maybe you can just explain how your working experience, like maybe you face, what is your biggest challenge during working as a cardio nurse?
The biggest challenge, I guess, it's they're a time bomb, I guess, because most of the cardio cases comes in either acute or chronic. So on the more acute side of things, they're usually like the quite critical heart attack patients, where they come in with chest pains and they come in with breathlessness, they're sweating, like they feel like literally dying, like they can't breathe. And when it comes to the heart, there's this thing called the golden hour. So when a person gets a heart attack, his survival rate increases if he gets treated underneath 1 hour. So yeah, and that being said, because we do get patients with heart attacks coming in to us quite frequently, and some of them are okay, some of them are already like out of it, like they lost consciousness, they need to be intubated, and and the main goal of everyone in that team is to get the blockages open up as soon as possible. But in that time frame, a lot of things could happen, like the patient's heart could just stop suddenly, and you have to start CPR, and we've got to like give a lot of medications to restart back the patient's heart just to get it beating, so we have circulation going on. So I mean, our body, this is the pump, technically the heart is a pump. So the moment the pump stops, blood doesn't go anywhere. So so that's the ultimate goal.
But I have one also last time I have one friend also mentioning that is the management of the hospital also kind of the process of like sending the patients to the ward, like emergency surgery and stuff like that, because last experience before that they have to search like their files before doing the surgery.
Oh, okay.
So yeah, as you mentioned that the heart is already having some problem emergency.
I can picture that happening, but I don't know how things are like in Malaysia, but for us in Singapore, again, technology advancement has allowed all of this to happen. So basically, the flow is now when a patient gets a heart attack or he collapses outside of the hospital, so an ambulance would come and fetch him. So the first thing that the treatment process starts even from the ambulance. So they would get the patient's identification, like the name and IC number, and do an ECG. So that ECG with the patient's name and IC actually gets transferred to the hospital, the nearest hospital's ECG machine. And from there, the moment we get the IC, we sort of like have a system. So the moment we key in that patient's IC in the system, we could access all his medical records instantly, even before the patient gets to the hospital.
So no matter which hospital this person is?
No matter which hospital you are. So I think that's one of the things which technology has really helped in sense of like getting the patient treated as soon as possible, because usually when and before the patient actually needs an emergency bypass surgery, he actually needs to go through the angiogram first to see the extent of the heart attack. So if it's so bad, if it's so terrible, then they would say, okay, this fella needs like an emergency bypass surgery. But unless it's like out of the ordinary case, the patient will be pushed immediately from the cath lab to the theater. But otherwise, he would be stabilized first in the cath lab, in the angiography center, and then he would be sent to the cardio monitoring unit or the ICU for the heart section. And then they would have to obviously do the necessary blood tests first, make sure everything is optimized before he is pushed into theater. Because yes, it's a very big surgery for an open heart. He needs like he needs to technically be fit before he even starts the surgery. Otherwise he's just gonna die. He's just not gonna make it, or he's just going to have like a very bad prognosis post surgery.
So that's really a big surgery. But for normal people like us, maybe when we're getting old, right, of course these cardio problems is prone to happen. So maybe, is there any symptoms that maybe we know that we're having heart problem, or how do we avoid getting a cardio problem?
Okay, so I think heart problems usually start when first it could be congenital, which is something we are born into. Second, it could be genetic. And third, it could be our comorbidities, like if we have diabetes, if we have hypertension, and if we have high cholesterol, then we are obviously more prone to getting heart disease, and especially diabetes, because most of my patients who I encounter are patients who are with diabetes, cholesterol, or they smoke. So if you live an unhealthy lifestyle, like you eat takeouts every day without knowing how much oil they use to cook the food, how much salt they're using in the food, and if you know that your parents have diabetes and you are constantly feeding yourself with sweet foods and you don't get yourself checked, and you may unknowingly have diabetes. So I guess it's just the awareness. I guess like for me, I know my grandmother has diabetes, but my dad doesn't have it. So I do have the hereditary risk of getting diabetes. So I just sort of like watch my diet. And obviously as nurses, we do get medical checkups. So we do need to check ourselves, like cholesterol. We do need to check our sugar levels. So I think when it comes to the heart, I always tell my patients that prevention is always cure. And I think people should always keep this in mind, because curing the disease when you already have it is much more difficult than when you don't have it. So so I guess like if you can get those medical checkups, check your cholesterol, check your blood sugar, check your blood pressure, keep to a healthy diet, like although sometimes we are prone to like delicious food which are cooked unhealthily. So like,
Yeah, mama.
I guess yeah. I mean, I'm guilty of it too. I just had KFC like 2 days ago. So but I only consume KFC like once a week or maybe once in 2 weeks. Like or once a month. Yeah, that's how low I consume them. Yeah. But otherwise, I would obviously always go for like healthier options. And I mean, and if you don't like exercise, I think you should start to like exercising. Like, it doesn't have to be those kind of like rigorous exercise activities. It just have to be what your body is capable of doing, like light walking, like, or if you love gardening, then do gardening, like just keep your body moving all the time when, and like train your heart to be more like capable of getting stressful things. Yeah.
Oh, talking about exercise, maybe I have one questions about if someone who already unfit and when you ask them to exercise, their heart rate actually spikes sometimes to 190. So is that normal? Or
okay, no, it's not.
He should just like, I should steady and try to rest or find some corner to breathe or something like that. Yeah.
Okay. So all right. So the thing, when we know we have diseases already, like if we already know we have a heart problem, we should always consult in a doctor before we resume our normal activities, before we know we have a heart problem.
Okay.
Because obviously the heart functions are going to come down when it's already not at its original state. And I think that for me is important, because you don't want to like stress your heart to 100% capacity when you can only tolerate the 50% capacity of function. Okay. So yeah, ideally, if you already know you have a condition, always seek medical advices from your doctor, because they are able to do tests to know what is your heart function status at, and they could advise what sort of activity which is safe for you to do. Yes.
But if they do not know that they have this kind of problem, yeah.
So that is where it's important that you get medical checkups.
Okay, but it's something like
to know.
Yeah, it's something like maybe they don't do medical checkup, but they just feel like,
I know.
Yeah.
I mean, that's pretty unfortunate, I guess. Not knowing, but okay, so I guess it's a telltale sign then. So so maybe you don't know you have a heart problem, but so what if you know that you have diabetes or you have cholesterol or hypertension? So I think it's worth it to get yourself checked, unless you're like me. So I'm completely healthy, but I didn't know that I have an underlying disease, a heart disease. So that, I think I have encountered patients who are young, 30 years old, healthy, no diseases, and suddenly came in with a heart attack. So so I think from there then on, I haven't got into any studies that actually say like, what if you don't know and you sort of like, play badminton and suddenly you get a heart attack.
Yeah, because I think that's the most common thing that happen now. And
I guess so. I mean, younger people are getting heart attack. I can see that trend here in Singapore. And but when I sort of ask the patients, like, do you eat out every day? Yeah. So do you smoke? Yes.
So it's based on their sedentary lifestyle and stuff like that.
Correct. It's really a lot to do about how you live your life. So like, if you're a smoker, obviously that's already jeopardizing your health. So if you don't eat healthily, obviously that's already jeopardizing your health. If you Oh, one more thing, stress. If
Yeah,
you
yeah.
live like a stressful lifestyle, I could honestly say that is also one of the contributor to heart attacks as well, because I had this one patient who is a young female who was about in her 30s. And when I asked her, do you have any like disease? Do you smoke? Do you take out? No, I cook at home. I don't smoke. And then when I asked her, do you work in a stressful job? And she's like, yes, I think I do. And I was like,
Mm. Okay.
so
But Singapore is always stressed on that.
yeah, I mean, yeah, I guess you could say that, but I think if I could give anyone any advice, um, regardless of your social status or financial status, like getting a medical checkup is always a good idea.
Mm.
Government, I don't know, government usually have those like packages, because I think my mom does those, like
Okay.
yeah, so she goes to the clinic and does it under the government subsidy to get her hormonal checkups and things like that. Yep.
Okay, okay,
Yeah.
that's good. So next question will be how long does it take for a patient that who have been through surgery, and then does it really
Mm-hmm.
cure, or is
Oh,
just that?
rehabilitation.
Yeah.
Okay. This is interesting because before I was in the lab, I was actually in the
Mm.
ward, and I was actually taking care of patients who are post bypass surgery.
Mm.
Okay, it varies.
Okay.
I would say um, you wouldn't make a full blown surgery. I mean, full blown rehabilitation.
Okay.
The If you have like other diseases, like I find that when the patient has diabetes, hypertension, or hyperlipidemia, or three altogether, they would
Mm.
take the longest to actually recover from the surgery. And it also has something to do with your age. So obviously, younger people, even though they have diabetes, no, I wouldn't say diabetes. Diabetes is the worst. So if he's younger,
Mm.
um, he obviously would do better during rehab, but for older ones, they would usually take longer for rehab. So it could be from like 1 month to 3 months. I'd say 3 months at least, 3 months to 6 months. Yeah, because what my hospital does is post bypass surgery, they make sure they see everyone after the surgery at least 1 month later.
Mm.
And they actually get enrolled to a cardiac rehab program,
Mm.
which helps the patient um, go back to his, I mean, at least close to his pre-morbid, um, independence.
How about their diet? Yeah.
Diet definitely has to change. Obviously, it
Mm.
definitely has to change, especially when you are diabetes. If you
Mm.
have really, really bad sugar control, you're
Mm.
basically just wasting your life away. Yeah, because diabetes clogs up your arteries. Like, it literally eats up, I mean, it's the worst thing to see on an angiogram, really. Also, if you smoke, you have to stop smoking. Also, if you have cholesterol, you obviously have to eat like low cholesterol or good cholesterol diets. Yep.
Mm.
And obviously take your medications.
Talking
Mm-hmm.
about cholesterol, so
Yep.
actually heart patients might have, I saw some of my patient that actually have medications for the heart, so they have a
Yep.
lot a
Of
lot of
course.
different type of medication,
Yes. Yes.
but they also wanted to take supplement in the same time. Do you actually think that it's advisable to do that, or should they just stop their supplements and just carry on with the medications that doctor advised them to?
Prescribed.
Yeah.
Okay. Supplement wise, I think again, because that is a drug. I mean,
Mm.
it is in some sort of a drug. So always check with your doctor whether or not it is safe to consume together with your normal heart medications, especially those traditional Chinese medications, because um, we don't know what the functions of the medicines are. So yeah, some of them have functions to thin your blood, and you are already on blood thinning medication. So yeah, so I think you just checking with the doctor is always the safest options.
How about
for that.
the omega-3, omega-6, those
Oh,
types?
fatty, healthy fats. Okay, healthy fats. I think if you are a normal person, consuming omega-3, omega-6. I mean, I consume them myself actually. Because they're healthy fats. Generally, they're meant to serve your body well. Because so I guess it's knowing yourself. I guess, I mean, because if you don't balance it out, like you take good cholesterols, but at the same time you also do other like unhealthy stuffs, that is obviously going to like make all the effort waste away. So but consuming omega-3, omega-6 post heart surgery is also, I mean, I think it's safe to actually consult with a doctor first before taking anything. Yeah, because I can't advise you that. I mean, because usually usually these patients, they will need to do more regular blood checkups. So they will need, so if they're known to have cholesterol, they will need to check their cholesterol level like every 6 months. Yeah, so if you've been consuming omega-3, omega-6, then your what's that, HDL would be high, I guess, like the good cholesterols would be high, but there's nothing bad about that. I mean,
how about triglycerides? Triglycerides, is it linked to heart disease?
TG. As I know, what the doctors usually see in a lipid profile are the total cholesterol, the LDL levels. I mean, TG usually they wouldn't like. It's not such an important value, but there is a medicine which would. I mean, this pharmaceutical company comes up with medicines which aims to bring the TGs down. Yeah. So but more of the values which the doctors would normally look at is the total cholesterol and the LDL level.
Okay.
And TGs are usually okay. If it's high, it's okay. You know, like usually like the general cholesterol medications would cover lowering down the TGs as well.
So after like mentioning about the surgeries of the heart and then the cardiac, so some people might who needs pacemaker actually? What determines? Yeah, because pacemaker is something that actually last time is quite new for me, because I never knew that someone will need a pacemaker to support their heart pumping. And is it because they are born with lower pumps, or
no. Okay. Do you have any friends who actually needed pacemakers?
Yeah, I have.
Oh, okay.
Yeah, that's why I am curious actually.
Wondering. Okay.
Any alternative to actually they do not need this pacemaker anymore, or
okay. All right. So pacemakers are actually devices to, it could be a preventative treatment, or technically just a correction, because pacemakers are usually implanted in patients who have irregular heartbeats. Yeah, so irregular heartbeats are usually more to the heart itself being able to generate its pulses. So it has something to do with the nodes. So and also the general muscle area of where the nodes are giving out those pulses. So I think most of the patients who needed a pacemaker are usually patients who, one of the terms is sick sinus syndrome. So it means that the heart beats fast and then slow, fast and then slow. Or the patient actually, the heart actually stopped beating for 5 seconds. So these patients usually come in to a cardiologist either by referral, or either, I think, the most of the symptoms are when they usually feel dizzy. Okay, so sometimes they have dizzy spells, or they can't breathe well, or they have water retention on their legs, and just the feeling of palpitation. Yeah, so these people, so they usually come in and then they go to the cardiologist complaining about, oh, I don't know why I feel dizzy, or I have partial hypotension, or my legs are swelling and things like that. So obviously, I mean, if it's involving the heart, they would do an ECG. So if ECG cannot catch them, then usually they would do a Holter. It's called a 24 Holter. So this is a device which is strapped to the patient for 24 hours. And then the patient will come back to the doctor with a full report of 24 hours, because these missed irregular beats could happen even when a patient is sleeping. So that's where you get like sudden cardiac death, like the guy slept and he never woke up. So it could be because his heart like technically paused and it just didn't beat again, and then it could be a node problem. So yeah, usually patients who need a device in is because the heart cannot generate its own electrical impulse anymore. Yeah, or it's generating it at a very irregular beat that would cause death to the patient. Yeah, because
But can it be removed, or is it
usually it's pretty lifelong. Usually it stays with you like forever, because you already have that problem in your heart that nothing but a device could fix it. But I guess that's how medicine helps people, because God knows how many people died before these pacemaker were actually invented. And these days the devices, they actually they're actually quite advanced, because you have devices that would actually deliver shocks. So shocks by when you see those emergency doctors, like they use the pedal and so those devices are actually capable of detecting arrhythmias. So let's say your heart rate suddenly goes into haywire, and it's like, I need to give a shock, and it will deliver a shock, and the patient will feel that a shock has been delivered. And another wondrous thing about technology is these devices now have a monitoring kit which would flow the rhythms, whatever activities, any shocks delivered to the hospital or to the vendors who are actually who is the vendor for the devices, and they would actually report it to the hospital, like, hey, one of your patient had a shock, like like if it's an abnormal shock, let's say he got shocked 5 times, like I think you should take a look into it, like so maybe his leads are like displaced, or maybe his device is faulty, or maybe he's just having more irregular heart rhythm. So so
wow. This is like something that I just know. Well, just put aside about surgeries and stuff like that. Maybe just tell about your own experience, maybe happy experience that you've been through as a cardio nurse.
A happy experience. I think my happy experience is when my patient actually survived. I mean, when I was in the ward, obviously, the happiness for me is when I get to see them recover and actually walk out from the ward after being with us for 1 or 2 months, like from being really, really sick, from being like just laying in bed with so many tubes, because post-heart surgery patients usually minimum have 1 chest tubes, like they have a drainage tube out of their chest. So usually they come in 3, because post-surgery, it's a big surgery, and
Yeah.
your muscles, your tissues, they're disturbed, and there's going to be a lot of fluid that's pulling up, so they need that fluid to be exited. So yeah, from being in that state to be able to sit up, to be able to walk to the toilet, to shower, wash their hair, and then to be able to take a step out of their room, and finally to be able to like walk out of the ward healthy. Like obviously that's just happiness for any nurse who wants to see their
Of
patients.
course.
Yeah,
For
to
anybody is, of course, yes.
yep,
It's a happy
correct. And
moment. Yeah.
and now I think for me in a day, I would feel happy if none of my patients died, really.
Yeah.
Because it's such an acute setting. It's such a very intense, stressful environment, and like your patient is like 50-50, 60-40, 70-30. We never know. So as long as that fella survives, like, oh, I'm happy. I'm happy for you. You live. But yeah. And then if you're gonna ask me the sad part of being a cardio nurse, I think recently I discovered that people do take their health lightly. Like I would have patients who multiply have chest pains and needing to do angiogram over and over again, and just because they couldn't change their lifestyle. And plus these people are young. Like, okay, come on, we spend hours fixing your heart vessel because you don't want to do a bypass surgery. Yet when you recover, because it's so minimally invasive, it's just a small poke at the hand,
Yeah.
and then everything gets done through there. Like you just need to lie down there so you don't feel the pain. And then these people go out and they start smoking, and then they don't take their medications, and then they start eating takeouts again. Like, so what are all our efforts are for? Like, that's the most frustrating thing. Like, I wish I could just would you want to take over my job?
Maybe this time you might have suggestions, or maybe they can put in a group. I think, is it better, something that motivates each other? I don't know, because now that's what gyms do, right? They just want to lose weight. You put them in
Yeah.
yeah.
I think the hospital, the system, everything, the whole treatment is so comprehensive. It's so integrated that there are multiple teams on board of taking care of one patient.
Okay.
So for the mental well-being or the physical well-being of the patient, or the follow-up of the patient, like giving them motivation, usually they would have a different group of people. Like they would have the rehab program people overlooking that section. So I mean, the most I could do as a nurse to my patient, like is give them advices there and then after the procedure. Like, sir, you already know you have this, you already know you have that. So just remember to put yourself first, and try to change your old habits. Like, if you drink coffee with sugar, try not to drink coffee with sugar anymore. And then they'll say, oh, 很苦, it's very bitter. And then I'll be like, well, would you rather take a bitter coffee, or would you rather take your a more sick like which one would you choose? Would you choose healthy, or would you choose bitter? So they'll be like, oh yeah, we'll try. I mean, that's the best they could do to us. Like, we'll try. But well, hopefully, like, their efforts would really, like, they would really take their efforts seriously in trying to change their lifestyle. Because
yeah, that's true. So thank you for sharing, and then thank you for all of your time today. And I know it's Raya.
No, it's
And
fine.
Hari
I
Raya
have
again
nothing
to
to
you.
do anyways. Thank you.
And thank you for your contribution to the community and sharing your
Oh,
knowledge.
it's fine.
Yeah. So
Oh.
before this ending this video conference, maybe you wanted
Yep.
to provide an advice for people who are viewing this video.
Um, keep active, eat healthy, sleep well, de-stress when you need. Um, medical checkups, know your body, yeah, know yourself, and always seek help. Yeah, always seek help. So like it's a package. Like mental, physical well-being is it both plays. Like some people come in with chest pain when actually it's just anxiety attack. So
Oh, okay.
yeah. You know,
Okay.
yeah. Because you know the mental pain is just so severe that it projects out to elsewhere of the body. They get body aches, they got tummy aches, you know, like their nerves are fired up, then they get chest pain and they're like, oh my god, I'm having a heart attack. But actually, you know, it's just panic attacks, and then started
Mm,
cannot breathe and things like that. So yeah, my guess is, and if if you already have known conditions, then continue to take your medications. Don't ever stop, and go to the doctor for your medical checkups, for your yearly checkups, and yep, try to live as healthy as possible because we only live one life. Yep.
yeah. Okay. Thank you, Jehan.
All right, thanks Kim, thanks for having me.
Thank you.